Hi everyone, my name is Dustin Simmons and I'm an LPN to BSN student at Indiana State University. I'd like to talk with you today regarding diabetics and foot care. Diabetes does run in my family. My father has it, my uncles have it, my grandfather had it. I even had my grandfather and one of my uncles lose a leg due to this disease. And I'd like to talk to you about this, which is something that's very, very near and dear to me. Before we get started, I would like to ask you to take a moment to go take the pre-test for this course. That way you can better assess your knowledge before this course starts. The learning objectives I would like everyone to go home with is students will be able to identify the comorbid conditions that contribute to diabetic foot wounds, the ability to identify the impact that these foot wounds do cause on patients, identify the need for education for foot care in this patient group, identify the successful strategies for education in this patient group, and also identify some free resources for diabetic patients to use. Here are some facts about diabetes. Type 2 diabetes alone currently affects 422 million patients worldwide. This isn't even including type 1 diabetics who are born with the disease. These are only the patients who develop the disease later in life. Diabetes is one of the most common causes of severe comorbidities that we currently have. And because these comorbidities are so severe, we're seeing more and more admissions to the hospitals within this patient group. When I was working inpatient, it felt like almost every patient I saw had some history of diabetes, whether it was type 1 or type 2. So this is becoming a very serious problem both in the United States and worldwide. There are two major problems that affect diabetics that lead to prolonged foot wound healing. That is peripheral arterial disease, which causes decreased ability of blood to reach the peripheral extremities. This leads to decreased oxygenation, poor nutrition in those affected extremities, which overall leads to impaired wound healing. Also, peripheral neuropathy. The patients are not able to feel their feet, and this leads to pressure sore development and also some foot wounds that just go unnoticed for prolonged periods of time. And because of that, more serious complications can develop. The pressure sores that we're talking about, if they're open for long periods of time, are just a massive source of infection that can eventually lead to sepsis, which can lead to death and possible amputations. Infection within these wounds is very difficult to treat because diabetics often have higher amounts of sugar within their blood, which obviously the bacteria feed on and just multiply, and once it gets in there, it's very difficult to get out, which is what happened with my grandfather. He had surgery on his knee. He developed a staphylococcus infection, and the docs could not treat it, which led to that amputation. Ultimately, this all leads to increased risk of wounds and increased risk of infection. The wounds develop and they are very difficult to manage if the patient doesn't know that they're there. It creates many problems for both the diabetics and their families, which lead to significant health problems and severely impacted quality of life. Due to the increased prevalence of diabetes in our patients and the impact that it is having on our patient population, the need for proper foot care and wound management and wound identification in diabetic patients is absolutely imperative. One study found that in 10 participants, none had prior education on proper foot care. And of those patients that participated, 4 had prior diabetic wound-related issues on their lower extremities. And what this identifies is a massive gap in care that we are creating for our diabetic patients that is impacting them greatly. What this all says to me as a nurse and as a future BSN is what can we as nursing professionals and ultimately patient advocates do to better assist our patients. As nurses, we could be the ones conducting these educational courses for foot care and foot wound management. One thing that we can do is conduct pre-tests. This will allow us as nurses to identify where our patients' gaps of knowledge and gaps of education may be. It'll also be a chance for the patient themselves to identify where they need to focus their attention. We can also conduct these classes in a group setting. This will allow crosstalk and allow some less experienced patients to speak directly with more experienced patients. Some patients who may never have had a foot wound or a diabetic wound may be able to speak with a patient who has and gain some insight as to what worked for this other patient and what didn't work for this other patient to help them better manage their own care. Another thing we can do is allow family members to participate in these trainings. This will allow the family members to actually be a check and balance system for the patient. They'll be able to spur the patient into reminding them, hey, you need to do this on this day, or have you checked your feet in the last week? Have you been moving around a lot? Just wherever the patient may be lacking, the patient's family can actually help spur them on. Also, we can conduct a post-test. This will help us as nurses evaluate A, the effectiveness of the course, and B, if the patient's actually got anything from it. It'll allow us to kind of see where we need to develop better strategies for education and where we need to focus our attention. All this will hopefully lead to a greater patient involvement and patient participation with their plan of care and also just their overall knowledge base in prevention of any diabetic foot wounds. As I hinted at earlier, diabetes is a very complex disease process, and it's something that requires a lot of education for the patients. So here I've just listed a few resources that are completely free on the internet for any patient or nurse that wants to, give this to anybody. The first is over at diabetes.org, and it's all about foot care, which is what we've specifically been looking at in this video. Next is over at the CDC website, and this is all about diabetes meal planning. It will help better assist diabetics in planning their meals. Next one is something that I see where I currently work quite a bit, and that's medication education. It's a guide that will help diabetics better understand the medication that they're put on, whether it's oral hypoglycemics or insulin. And that's again over at diabetes.org. In conclusion, diabetes is a disease that is growing at an exponential rate and causing many problems to our patients the world over. Diabetics may not have proper education regarding proper foot care, which is something that we saw in the study I talked about. And the biggest thing that we can do as nurses and patient advocates is education. Just education, education, education. Thank you all for listening, and I would just like to ask you at the end of this presentation to just take a minute and take the post test just to kind of see what you got out of this course. Thanks.